When I got ready to sign the bill, I thought, I'm going to sign it with one of those kids' crayons. So I reached over and I said, can I borrow this? And I took a crayon, and to my knowledge, it is the only time in the history of Arkansas that a piece of legislation was signed by a crayon.
Obviously, Arkansas has, I think, led the country in terms of reducing its rate of uninsured kids.
Well, you cannot help but be proud of going from near the bottom to near the top on something that's as important as helping children access health care.
Until that time, there had never been anything quite like this. So Arkansas, in creating ARKids First, really created a template for what later would become SCHIP, where a lot of people see SCHIP as sort of the Children's Health Initiative. You know, those of us in Arkansas could say, yeah, they got the idea from what we did.
But the fact that Arkansas, low-income southern state, stepped out and did this early, I think got people's attention, and I think showed people what could be done. We had a task force that had been created by the previous governor of about 35 members whose mission was to find ways to cut Medicaid spending.
I mean, what folks have kind of forgotten over the years, that what prompted this conversation initially was that there were proposed Medicaid budget cuts on the table.
Well, the meeting was an assemblage of people from really across the spectrum who were involved in advocacy for children, health care, Medicaid.
Amy Rossi at Arkansas Advocates called me the day before and said, well, instead of all this talk about cuts, why don't we ask him if he would consider expanding coverage to kids?
I knew some of my colleagues thought I had lost my mind.
And she made a very, I thought, logical and rational appeal for why aren't we doing something for the uninsured kids?
And this new governor, he didn't think about it very long. He said, that makes sense. That's a good idea. We need to do that. And that's the way it happened.
For her in that meeting in front of all those people to raise her hand and say, here's what we ought to be doing. Would you be willing and interested if there's a way to get this done? It took a lot of courage on her part.
So we just kind of went for broke that day, thinking, if he wants the plan, we've got a plan.
It took nerve, but she's never been short of that, so.
It was the day's work. Maybe, I kind of don't think if you don't have some of that gutsiness in you, advocacy is not a place you need to be.
Once it got established, I don't ever recall but a handful of people who just didn't like it. Most people, even those who had been critical before, realized, my gosh, this works.
I think like a lot of things, ARKids First came to be because of a special combination between political will and social need. So somebody like Amy Rossi was able to articulate that social need, but there was also political will to help kids.
The political will hadn't been there, and getting the political will all at the same time lined up was sort of magic.
I think the fact that I was a Republican in some ways gave it maybe a little bit of boost that it might not have had, because people weren't expecting a Republican to be advocating something that some would see as an expansion of Medicaid. I saw it as an alternative to the traditional form of Medicaid that would put a wider net around people that had nothing, and people that were working. These were working people.
Leaders made the choice to come together and come up with a solution to improve the health of kids in our state. And it was not a political debate. It wasn't based on what party you were affiliated with. It was just about how can we do better for the kids in Arkansas. Just thinking about long-term the economic development of our state, we're investing in these kids early and ensuring that they can become healthy, productive adults. And I'd like to think that I'm a good example of the return on that important investment in kids in Arkansas.
There was a family over in Polk County, which is Mena area, and this man had been getting medicines for his kids at the farm supply store, and when they needed medication, he got medication that was intended for animals, antibiotics, and he was doing all he knew to do because he couldn't afford the medications at the pharmacy, and he was making do. Now, you know, that got to me, and I thought, my gosh, here's a dad, and you know, he can't afford medicines for his kids, so he's going and trying to do the best he can by getting him an antibiotic that was intended for a puppy. I mean, ARKids changed that, and man, how can you not think that's a good idea?